All right, here we go, folks. An unknown flu-like disease has been detected in Congo that is sending the World Health Organization into an urgent probe. Again, an unknown flu-like disease targeting women and children has killed 143 people in only 2 weeks, as the World Health Organization is scrambling to launch an urgent probe, calling this an extremely worrying situation. We're going to talk about it today.
The following program is brought to you by friends and partners of End Time Headlines.
All right, what's going on, guys? End Time Headlines here. Ricky Scaparella, founder, voice of End Time Headlines. We want to welcome you to today's program. We got some breaking news coming out of Congo. I want to show you this report. Again, this is something we talked about yesterday. If you didn't catch yesterday's program on Tuesday, December 3rd, we talked about some things to look for as we head into 2025. One of those things would be pestilences, plagues. All this stuff is going to increase. We know that the World Health Organization, the WEF, the CDC, the elites, all of them has warned, and they have been concerned and extremely worried about the next pandemic, what they call as Disease X. And could we be looking at it right here? Could it be emerging in Congo? This is from the U.S. Sun. They're calling this an unknown flu-like disease. Now, here is the concerning part about this is the verbiage used, even in the headline. This unknown flu-like disease targeting women and children. It is not hospitalized. It is killed, guys, 143 women and children in just 2 weeks. This is so concerning. Look at this headline. Officials have warned that the unknown deadly illness is extremely worrying. Let's read a little bit more about this. An unknown flu-like disease targeting women and children has killed at least 143 within a 2-week period. Again, 14 days. Those infected in Congo have suffered from symptoms including high fever and severe headaches, with the World Health Organization launching an urgent probe. Wow. Deaths are being recorded in Congo province, situated in the southwest of the Democratic Republic of the Congo and on its border with Angola. Deputy Governor of the province and its Minister of Health say medical teams have been sent to collect samples and carry out an analysis in order to, quote, identify the disease. So at this point, again, they're calling this unknown. They don't know the source, they don't know the cause, and they don't know the identity. But other officials have warned that the situation is, quote, extremely worrying and that the death toll continues to rise. On November the 25th, up to 140 deaths have been reported from the disease in just 2 weeks. Again, none of us knew about this. We were all traveling. We were on our planes. We were in our vehicles. We were going to our families. We were having family over. We were celebrating. We were preparing for Thanksgiving. All the while, across the pond, I guess you could say, across seas. Meanwhile, in the DRC, we have 143 reported deaths, and again, according to the report, the death toll continues to rise. Medical experts are scrambling to find out what it is. Due to a lack of treatment, those infected with the unknown illness are reportedly tragically dying in their own homes. And a local epidemiologist said that women and children were the most seriously affected by the disease. Wow. Health officials are yet to report on results from the samples and tests, and it is unclear whether patients have tested negative for other common diseases. No data as of yet has been released on the number of patients that are suspected to have been infected or hospitalized in this horrific outbreak. A World Health Organization spokesperson said on Tuesday that the UN Health Agency had been alerted to the presence of the disease last week. Again, none of us knew about this. Not a peep out of the mainstream media. This is the first I've heard of this. It also said it was working alongside DRC's public health ministry to further investigate. Now, guys, if you remember, this was the case when the last pandemic happened in China. Before it was ever alerted to officials, before this ever got out, and before it was ever made mainstream, the death tolls were stocking. But the World Health Organization knew about it. So that makes me wonder how long this has actually been going on and we don't know about it. But now it's making news. Now it's making headlines. Their civil society leader said that, quote, the situation is extremely worrying as the number of infected people continues to rise. Ponce is a rural health zone, so there is a problem with the supply of medicines. The DRC recently had an outbreak of an ultra deadly strain of Mpox. You remember this? This was what this mutated form of this, what they called this ultra deadly strain of Mpox. By the way, that made it all the way to the United States. There was an individual that was diagnosed with that. Again, this was declared by the World Health Organization as a, quote, global public health emergency. So what are they going to do about this? The highly contagious disease killed at least 500 and infected 13,700 during the initial outbreak this year. So guys, let me know in the comments. Let me know in the chat, in the comments, do you think this is something that's going to blow over? Like the Mpox ultra strain, that it wiped out 500, infected over 13,700, but then it kind of just dissipated and blowed over? Or could this emerge, evolve, and mutate and spread? And could this be the next disease X? The virus, formerly known as monkeypox, spread to 12 other countries in Africa, and scientists were concerned back in August about how fast a new variant of the disease is spreading and its high fatality rate. A previous Mpox public health emergency declared in 2022 was caused by the relatively mild version of the virus. However, this time, a far more deadly variant surged. And in 2019, a deadly Ebola epidemic in Congo. Y'all remember that? I definitely remember the Ebola epidemic in Congo that killed more than 1,600 and was declared an international health emergency. The World Health Organization confirmed the crisis at the time after a case of the virus was found in a city of 2 million. So again, guys, I don't want to spend a lot of time. Just want to give you this breaking news report. This is something I definitely want to keep. I want to keep my tabs on this. I want to pay attention to what's going on and see how this develops. I don't suspect, being that it's being reported in the location that it's at, I don't believe that the U.S. is going to put too many eyes on this. So I'll continue to do research, diligent research with sources outside of America, and see if we can get more information on this. Again, it'll be interesting to see if and when we hear about exactly what this is. Again, health officials are yet to report on the results from these samples and these tests that have been sent out, and we're waiting to see the results of what strain or what virus or what disease or what this is. But again, they're calling this extremely worrying, and it has wiped out 143 people, and the majority have been women and children, and it is in 14 days, and it's continuing to wipe out people. And again, according to the report, people are dying in their homes. So again, endtimeheadlines.org, endtimeheadlines.com. Guys, if you appreciate breaking news updates and alerts like this, we want to keep you up to date with everything that's going on around the world, not just in the United States, but around the world from a biblical perspective. And the best way you can do that is download our free app right there on your screen. You could download it today. Pick it up at your app store. Go to your Apple or Android, depending on your device, and type in End Time Headlines. Download it today. Hit yes to push notifications. If you're watching a visual of this, under the description of this video, just click on the link. And once you do that and hit yes to push notifications, everything's going to be right there. Breaking news, updates, podcast, all the headlines right there at your fingertips. So we'd appreciate you guys doing that. And also, again, if this ministry bless you, encourage you, equips you, informs you, whatever the case may be, and you'd like to give back support or partner with us, we always want to give you that opportunity. Again, we are a partner-supported and funded ministry. We do not sell any merchandise. We don't charge for any podcast. No subscription fees. The app is up. The app is free. All that is absolutely free for you, and all we ask is just whatever the Lord puts on your heart. Again, you can contribute, partner, whatever the case may be. You can do that 2 different ways. You can give electronically through the app, through the website. Multiple ways are electronically, or you can give by check or money order right there on your screen. End Time Headlines, P.O. Box 1391, Monroe, Georgia 30655. And of course, guys, we would love for you guys to help us out by just hitting that like button. Hitting that like button helps us get this out on Rumble, on YouTube, and across these platforms. You guys listen by Apple, by Spotify. You can help us by giving us a good report and a good review, rather, in the review section, and that's going to help us get eyes on our material as well and on our podcast. So we're going to sign off for today. We appreciate you. We'll see you guys on the next report.
Thank you for listening to the End Time Headlines podcast. We pray that you've been blessed and equipped by today's message. For more information about how you can help partner with our ministry, please visit endtimeheadlines.org.